What are the different sexually transmitted infections?
Your basic things, HIV, AIDS, gonorrhea, syphilis. There's a lot. Herpes and gonorrhea. Yeah.
HIV, STD.
HIV, it's very dangerous. Herpes and obviously AIDS, and I feel like, actually the mass, in this day and age, it's actually like a very, popularized thing, and a lot of people are actually becoming infected with the same diseases over and over again, and I feel like it might actually be more useful for us to take interest in helping other people as much as we do ourselves, regardless of the knowledge that the person that I'm passing it on to has of what I'm actually passing on to them. Because some people don't even know herpes exists. Some people don't even know how to get AIDS or how it actually happens or how to see that someone has it if it's even visible at all.
So despite the fact that people know about sexually transmitted infections or STIs and how to prevent their spread, STIs remain a serious public health issue. It's estimated that globally, more than 1 million people are diagnosed with one or more sexually transmitted infections on a daily basis. Now, STIs can have devastating effects on sexual, reproductive, and general health. Of great concern is their increased risk of HIV infection and transmission. In South Africa, the 7.9 million people living with HIV in 2017 also have high volume of STIs. Now, today we discuss STIs and UTIs. And we'll be joined in studio by a senior consultant at the urology department from Chris Hani Baragwanath Academic Hospital. And then we also have director of HIV, AIDS and STIs prevention strategies from the National Department of Health, and a professional nurse based at the urology clinic also from Chris Hani Baragwanath Academic Hospital. You can tweet us at SABC Health Talk or simply interact with us on our Facebook page, SABC Health Talk. So sit back, relax and learn from this bumper show coming to you just after a short break. I'm Dr. Silo Mutaung, and this is Health Talk.
This year, Nelson Mandela Day celebrates 10 years of a global movement that has made a difference in the lives of those with the most needs. Over the next 10 years, Mandela Day aims to mobilize governments, policymakers, corporates, civil society, and individuals to make a commitment by focusing on social justice issues and our call to action on the Mandela Day goals.
Did you know the big hole digging started in 1871 and ended on the 14th August 1914? The hole produced 2,722 kgs of diamonds. However, one diamond as huge as 490 carat of stone found in the open prior 1868 gave them the interest to dig. Extracted from 22.5 million tons of soil. Today, the hole sits at a breathtaking 214 meters deep. Kimberley Big Hole attracts tourists from all over the world, taking a vintage tram past the city, then cycling around the Big Hole.
We do not just speak. We let every voice in our nation find full expression in language and in culture. We do not just teach, we empower all people with education. We do not just bring you the news, we place you where the news is happening. We do not just entertain, we take you on journeys. We do not just broadcast sport, we create an arena for sporting heroes to inspire you. Ours is not just a job, it's a calling. To ensure that everyone in our nation is informed, educated, and entertained. We're able to do this because you do your part. SABC TV licenses. It's all made possible by you.
How should people protect themselves from sexually transmitted infections?
Use condom, and then I believe adults, before they get to dates, they go and test for everything. If they both agree towards each other to don't use a condom, I don't know, then they putting themselves in danger specifically.
Firstly, behave responsibly. Do your best to stick to one partner, and if you are going to be all over the place, then at least use a condom. But it is important that you learn about sexual health and how important it is for you to stay healthy.
Just condomize and abstain. I think that's the best thing.
I think people just need to be responsible, you know, and learn more about sexual health. That's the only thing that's going to keep them alive and everything.
First of all, they should use condoms. Plus, since they're young, so I think they should abstain from doing such.
Abstain.
And use condoms.
And use condoms.
Use condoms at all times, please. Protection is best.
I think we should probably just have enough care for each other. It matters most what the person with the sexually transmitted disease feels like about other people, because obviously having a couple of people that'll actually derive pleasure from passing it on, or making it as viral as possible, that becomes a really big issue. Obviously, if we had interest in actually helping other people as much as we do ourselves.
Okay, to delve a little deeper into the subject of STIs and UTIs, it's a great pleasure to welcome our guests. Dr. Robin Friedman, first up, is a senior consultant based at the Urology Department at Chris Hani Baragwanath Hospital. Welcome to Health Talk, Dr. Friedman.
Thank you.
Right. And then we have in the middle Dr. Tato Chiradikire, who's Director, HIV/AIDS and STIs Prevention Strategies from the National Department of Health. Welcome to Health Talk.
Thank you.
Right. And last but not least, we have Sister Musase Lesloka Mashabani, who is a urology and oncology professional nurse based at the Urology Clinic, also from Chris Hani Baragwanath Academic Hospital. Welcome to Health Talk, sister.
Thank you, sir.
All right. Perhaps let's start with the basics. I mean, we're talking STIs, and sometimes people don't quite know what we're talking about, STIs, STDs. I mean, clearly, there's a lot of people out there who know, but I'm sure there's some who still don't. What are we talking about? STIs, STDs?
So basically an STI, STDs, same thing. STD is just the older terminology. It's talking about sexually transmitted infections. So these are infections transmitted between two partners engaging in sexual activity.
Okay.
It can be a whole host of different organisms or types of organisms that can affect. So there could be bacterial infections, viral infections, fungal, parasitic infections, and they're basically spread on between partners as they engage in sex.
And to be politically correct or otherwise, when we say partners, what are we talking about?
It can be any partners, gay, straight, it makes no difference.
Right.
Male, female, everyone's equally affected by these diseases.
All right. Okay. I shared some statistics in terms of that globally that we have more than 1 million people affected or at least diagnosed on a daily basis by at least one STD. Do we have figures in South Africa in terms of prevalence or incidence of STIs?
I'm not sure on the exact figures. Perhaps, Sister, you know better.
Yes. Okay. So, as per our DHIS District Health Information System, on an annual basis, we report on what we call, I'm sure we will get deeper into it, MUS, which is male urethritis syndrome, and new episode treated on an annual basis as it's about 300,000 on an annual basis to date, yes. And with your common STIs, new episode, we're still falling within the global picture of about 1 million.
That's
annually.
Quite a lot. We'll come back to the different types. But sister, let's just understand. I mean, you're a urology oncology nurse based at the urology clinic at Chris Hani Baragwanath Hospital. Just tell us a bit about the clinic. What do you do there, and what do you see in terms of STIs?
Normally, we see most is the male, because of the female. Most they send them to gynecologists.
Right.
So most men are aged between 25 and 40, less than 40. So we see them, but the number is increasing daily because of people are ignoring their condoms, are ignoring to use the protection.
Yeah.
And we always preach to them that please kindly use the condom, because of if you're not using the condom, you can get complication and end up being operated.
Right.
So Dr. Friedman will tell you more about the operation they done, the complication done by STI.
Right.
Normally they've been seen at primary level.
Yeah.
Then when they come to us, they're already complicated.
Yeah.
Yes.
Before we speak to Dr. Friedman, let's speak to you, Dr. Charatgiro. In terms of the policy around, I mean, she's raised a very important issue around prevention, and I mean, this talks to directly what you do. Just tell us briefly around the policy aspect.
Right. So when we talk about sexually transmitted infections on a policy level, as the department, we actually recommend active screening of STIs at primary level, as you say.
Yeah.
Or whether it's at the primary health care, whether it's when one goes to test specifically for HIV, when you talk about counselors or even community health workers. The policy is that every individual should at least have at least 2 questions, symptomatic screening. Do you have or have you had vaginal discharge? And when you talk about the vaginal discharge, we talk about a different color, smelling uncomfortable, or pain during urination. So at least the 2 questions actively, whether one has come for one thing or another. Because that way, if we have active screening, then we're able to actively increase case finding, and then we can actually treat.
Yeah. We'll come back to, this whole notion of, on the one hand, awareness levels seem to be really high, but they don't translate to, reducing the actual incidence of these things. We'll come back to understand exactly why is it that, we're having this kind of scenario. But let's come back to the different types. Let's just talk about the most common ones that affect both males and females. So I suppose we can start with males and, in terms of the common infections. Yeah.
All right. So you can break it down into different groups. So bacterial we see fairly regularly. There's your gonorrhea, your chlamydia, bugs like that. You get viral infections. HIV fits into that group. Your herpes virus fits into that group. Certain fungal infections, such as thrush or chlamydia. Not chlamydia. So thrush can fit in there. Certain different fungal types of infections, certain parasitic infections. But we mustn't forget that HIV is the big overwhelming viral one, and that kind of tends to go with most of them. And in fact, in reality, most of these infections kind of live together. So it's not just one infection at a time that a person might have. They might come in and they've got a whole host of infections all going on, and they kind of all tend to live together, and you've got to treat them as a bit of a cluster rather than going and treating each individual type of infection which a person might have.
All right. So, I mean, you're based at a tertiary level, I mean, at Chris Hani Baragwanath Hospital, and primarily, I mean, these things should be seen at primary care level, at community clinics and so on. But they seem to filter through to you when there's complications. Just take us through some of the complications that you commonly see.
So, when these things aren't treated effectively and aren't treated early enough, that's when the complications start. And the complications can differ, obviously, between males and females. Typically in males, if the infection progresses significantly, it can result in infection within the testicles itself, resulting in swelling, resulting in pain. You can get the infection within the urethra, which is the tube which the male is passing urine through. Any infection or any damage to your body will heal with a scar. So those tubes, the urethra, can get scars throughout what we call urethral strictures. And then we find that patients find it difficult to pass urine, or they're passing drops of urine or burning when they pass urine. And then those infections can kind of progress to involve other organs. Females, similar type of story. The early initial symptoms are a discharge or pain or suprapubic discomfort. But then it can progress. The infection can spread up to involve the uterus, to involve the fallopian tubes. And then things kind of need a higher level of treatment.
And what's the prognosis generally with all of these complications? I mean, what's the worst that can happen?
From a urologic point of view, The big ones are the strictures, the urethral strictures. A severe stricture typically requires what we call a urethroplasty, which is a surgery to cut out the stricture or replace that damaged area and kind of get confluence going in the tubes again. Severe infections in the testicles, often they can create an abscess. Those abscesses we need to drain, but oftentimes that abscess can destroy the testicle. Sometimes we have to remove a testicle on a patient if it's completely destroyed with infection.
Yeah.
So you name it, as high as the infection goes, we need to do to repair.
What is the complication related to? Is it about the late presentation, or is it about incorrect or inappropriate type of treatment?
Often the presentation is late.
Right.
The initial treatment might be wrong.
Right.
There's a lot of patient factors as well.
Yeah.
Certain comorbidities or other illnesses which a patient might have, particularly HIV, makes the diseases spread in a somewhat unpredictable way. They can often spread a little bit more severely than you would in an immunocompetent patient as well.
Yeah.
So the whole trick is if you catch them early and you treat them correctly with the right antibiotic at the right dose, the right amount of time, you can often get on top of these things before they create the complications.
You wanted to comment, Sita?
Yes, to add on that,
Yeah.
You see, when we treat STI, most of the person in the community, they're not aware. We were not supposed to treat one partner. Partner was supposed to bring along the partner.
That's a very
so
important
it
point,
is useless because of they come alone, we treated them, and they went back to the community.
Right.
They spread again. What's happening again? They reinfect each other.
Yeah.
So my advice to them is to bring the partner along.
Absolutely.
Because of we waking back.
And I'm sure it talks to the policy there, but
policy,
we'll come back to that because we just need to go for a quick break. And when we come back, we'll continue our discussions on STIs, this time focusing on males. Please stay with us.
By so much human suffering, poverty, and deprivation. It is in your hands to make of our world a better one for all. It is time for new hands to lift the burden. It is in your hands to make a difference.
On Full View, the end of the day means unpacking the day's events. We recap all major news stories from around the world.
The African Union's decision to suspend Sudan's membership was made by the AU Peace and Security Council.
It was a unanimous decision. We said we'll give them up to 60 days.
And have in-depth discussions on what's happening in our country.
This economy, for it to grow, you need people that will be working in order for them to be able to have the buying power.
Visuals, they're busy shooting.
We drove around this.
As the world prepares to mark Nelson Mandela International Day this July, we speak to Africans on the continent and in the diaspora who are doing good. Individuals who reflect the values and legacy of South Africa's first democratically elected president.
It is a story about humanity's great capacity for goodness, for peace, and for hope.
Nelson Mandela was one of humanity's great leaders. He embodied the highest values of the United Nations.
Every day when you watched him lead from the front, from the back, from the side, was a masterclass.
Watch African Perspective on SABC News Channel 404 every Wednesday night at 9:30 p.m. Central African Time.
Welcome back. We are with Dr. Robin Friedman, Senior Consultant at the Urology Department at Chris Hani Baragwanath Hospital, Dr. Tato Chiredigire, who's Director HIV/AIDS and STIs Prevention Strategies from the National Department of Health, and Sister Musase Lesloka Mashabani, who's a urology and oncology nurse based also at the urology clinic from Chris Hani Baragwanath Hospital. Okay, before the break, we were talking about, perhaps let's start with you, Dr. Tato. The whole notion of prevention strategies, just from a policy perspective. I mean, she raised a very important issue around treating contacts.
Yes.
Right.
Yes. So initially, case finding.
Yeah.
We need to find, even if people are not coming in for STIs, we need to ask actively questions about symptoms.
Yeah.
And then when one has a symptom and needs to be treated, then what Sister was talking about, it's very important to get the partner treated, because then there's going to be infection to and fro, transmission. So at a policy level, we actually recommend partner notification slips. We call them partner notification. Is really a slip that one would take to a partner. They may not necessarily have to come back to me. They can go to another clinic. But at least the clinician who is dealing with them will know what they're dealing with, because we treat STI syndromically.
Yeah.
So that has been policy for quite a while, and it still really needs to be implemented, especially now, because STIs are increasing.
Yeah.
So it simply means reinfection.
Right.
So it's very important that.
Right. So let's cover, in this segment, we're talking about STIs in males. And we've said one of the major problems is that people tend to present late. Let's try and assist some of the people watching this show to say, okay, what are the symptoms, early symptoms that people should be looking out for in males, that there might be something wrong?
So the male needs to look at his history and say, has he been involved in a sexual contact, possibly unprotected within the last few days or last few weeks, perhaps. Right. And then he would be looking out for particular symptoms which he might have. So perhaps discharge from the urethra, from the end of the penis. Yeah. Perhaps burning when he passes urine. Right. Some itching or scratching on the penis itself. Mm-hmm. Difficulty passing urine, possibly a little bit of pain. And if he might have those symptoms, then it's possible that he might have an infection. And then we would have to just check and see from there.
Right. And what about, sores that might develop over time?
Depending on what type of infection it is, right. Particularly with herpes, with syphilis, they can get sores on the penis. Those sores don't always have to be painful. Yeah. Herpes typically has painful sores. Syphilis typically doesn't. Yeah. So they can get sores. They can get swellings even in the inguinal regions, in their groin. Yeah. Those are all telltale signs that they might have an infection.
Right. And Sister, you interact with these men that come to your clinic, perhaps,
yes.
With complications. What stories do you get around when they, present with symptoms?
Hey, the story we get from them, they tell you about the condoms. Maybe Sister, the condom burst during my actions. Yeah. So we advise them to go back to the clinic to get the education of how to use the condom, because you can't say the condom burst, while the condom is meant to fit each and every sizes. Yeah. So I don't understand the story say the condom burst. And I'm happy because of they have too much flavors that can. We have strawberry, bananas, and all the flavors. So I don't understand why. Yeah. Okay. Before, it was just a condom that you say, hey, I don't want to use this. But I don't understand, because of the government tried to do the nice things that, okay, they can be happy with the smell and all the stuff. Yeah. So, but they're still coming with the story of the condom burst. Yeah. So I understand they are not using the condom.
Yeah. So let's just have a general discussion around, that earlier point that I brought earlier, to say, despite the fact that we have reasonably high levels of awareness on, how STIs are spread and how they can be prevented, but you're still having high levels of, at least high incidence of, STIs in general, especially with HIV. What could be the factors around this? Your opinion?
Behavior is very difficult to change. Yeah. So this is really all about behavior. We need to understand, because as in the beginning we're interviewing the people from the communities, and they know that you need to use a condom. You see, with STIs, we need a barrier. And in this case, we have male and female condoms. And as she has already said, different colors, different scents, and male and female. So really, there's a wide choice out there. The other thing is you'll find that when you engage, when you're talking to clients, one would say, yes, I have a boyfriend. We were using condoms in the beginning, but now we trust each other. So, it's issues like that, because it's not even always about that. When one uses a condom, it's really just for protection. And we know that condoms do not only go for STIs and HIV, but even unplanned pregnancies as well. So it's a contraceptive. So it's very important that we keep promoting, we keep educating, so that people understand and maybe even make access more easy. Availability is there, so one just needs to go and pick a condom, use it correctly and consistently. It shouldn't burst. It's not made to burst. So it needs to be used correctly. And then it will do what it's supposed to do, which is protection, because otherwise then it's abstinence, as they have already said.
So we spoke earlier about the association, of STIs to HIV. The fact that HIV has been, the focus area for a number of years, in recent times, STIs have kind of taken a backseat. And with the fact that, people that are HIV positive, who have been on ARVs and, have non-detectable viral loads in their bodies, they get to that point where they say, okay, now we don't have a virus to transmit anymore. It's not necessary anymore to use condoms, when we engage in sexual activity. Your comment around that, because that's another way of, transmitting STIs.
That's another way of transmitting STIs. That will take me back again to the multifunction, the dual function of a condom. It is not necessarily just to prevent transmission or acquisition of HIV as another STI, but also other STIs, and as I said, unplanned pregnancy as well. So those are the messages that we need to punt, that we need to actually push in over and over, especially with the young people. That while one can actually be at a point where they feel like they're virally suppressed, they've managed in terms of HIV, but STIs are still there. And if one does not actually continue to prevent and protect themselves, they will actually still acquire STIs. And if we talk about somebody who may not necessarily be living with HIV per se, STIs also are associated with an increased risk of HIV acquisition. Because as doctor has already said, some may present with lesions, openings, and those are already entry point. So sores will actually increase acquisition or chances of acquisition when one does not treat.
Okay. So let's talk prevention. I mean, obviously we'll talk treatment just now. Let's talk prevention in males. People know that. Okay. Sister, maybe let's start with you. And I would imagine this is something that should happen at community health clinics, education.
Education.
At your level, are you doing any bit of education to people that you see?
Yeah, we do reinforce of what they did from the clinic. We still, education in nursing is continuous thing. So we keep on educating. Yes, we keep on teaching them, continue use the condom. Don't tell me about the condom bust or whatever. Yes.
In terms of treatment, I mean, clearly it's easier when it's early on. Just take us through the principles around treating males for STIs.
So we typically use what we call a syndromic treatment, which is a combination of different treatments to try and focus in on that group of bugs that we talked about earlier. There are certain guidelines worldwide which we use because there are certain resistance patterns. You can't use treatment that was fine 15, 20 years ago because those bugs have now become resistant. The Department of Health has given out very clear guidelines over which antibiotics to use for which patients, for which symptoms. And as long as we treat the combination of those bugs with the correct antibiotics, you'll get on top of most of them. Obviously, viral infections, you cannot cure a viral infection. So say a herpes infection or an HIV infection, you cannot cure it, but you can help decrease or relieve a lot of the symptoms with treatment. But for the others, for bacterial, for fungal, those we aim for a cure.
Okay, all right. Time for another quick break. When we come back, we now focus on the female. Please stay with us.
Mbaletsile Mthethwa joins us now live. MNS attorneys were mandated to conduct these reports and investigations. What sort of processes did they follow?
We heard Tiamo explaining that they worked with actuarial scientists in order to investigate these transactions.
Slap suits, tell us more about this.
The concept of slap suits, which is litigation often used by big companies to silence critics.
We as civil society won't stand for this kind of intimidation and harassment. If you come to South Africa, you need to obey the obligations that you have in terms of the laws of this country, including environmental laws.
A world that remains beset by so much human suffering, poverty, and deprivation. It is in your hands to make of our world a better one for all. It is time for new hands to lift the burden. It is in your hands to make a difference.
Welcome to Media Monitor. This is where we take a look inside the world of media, analysing the trends and the issues and the reporting of some of the week's top stories. A shocking report states that 51% of South Africans don't trust the news.
The trust levels in independent media have also come from media getting it wrong very often.
Does this mean that our journalists are not credible enough?
We got investigating journalists in South Africa, the best.
As the world prepares to mark Nelson Mandela International Day this July, we speak to Africans on the continent and in the diaspora who are doing good. Individuals who reflect the values and legacy of South Africa's first democratically elected president.
It is a story about humanity's great capacity for goodness, for peace, and for hope.
Nelson Mandela was one of humanity's great leaders. He embodied the highest values of the United Nations.
Every day when you watched him lead from the front, from the back, from the side, was a masterclass.
Watch African Perspective on SABC News Channel 404 every Wednesday night at 9:30 p.m. Central African Time.
Okay, welcome back and thank you so much for staying with us. If you just joined us, we're talking STIs and UTIs that we're going to be talking about later on with our guest, Dr. Robin Friedman, Senior Consultant from the Urology Department at Chris Hani Baragwanath Hospital, Dr. Tato Chiradikire, Director HIV/AIDS and STI Prevention Strategies from the National Department of Health, and Sister Masase Lesakamashabani from the Urology Clinic, also from Chris Hani Baragwanath Hospital. Let's try and focus on the males. Let's start with you, Dr. Friedman. The females, did I say males? Females. In terms of the common types of infections, just to reinforce, and the clinical features, what females should look out for in terms of, common signs and symptoms.
The females very, very similar to the males. It's the same bugs because they have to go between the two partners. Right. So again, it can be the bacterial infections, the fungal, the HIV comes into it. Again, their symptoms will be slightly different. Right. So a lot of the females, a lot of them might present asymptomatically, which means that they don't have any symptoms at all. Yeah. They might have these bugs living with them and they don't even have a clue that they're there and they're continuing to spread them. They might have a vaginal discharge. They might have burning when they pass urine. Right. They might have a bit of suprapubic pain over their bladder. Yeah. They might get what we call dyspareunia. Dyspareunia is painful sexual intercourse. Right. They might have an itch in their perineal area. Yeah. So those are the common signs that they might see earlier. But it's the same bugs, it's the same chances of infection as the males will have.
Yeah. In terms of vaginal discharge, perhaps let's just get there. Some would say, but I have normal discharge. How then do they differentiate between whether or not they're supposed to be normal? And
so again, on a policy level, all the symptoms, the signs that Dr. has talked about, those are the symptoms that we actually say just give these questions and find out if the client has any, and then you can actually refer to the nurse for diagnosis and for treatment. So in terms of discharge, yes, we do get a lot of, but we as women, we do have discharge every now and then. So what's normal? So what is abnormal is color. If the discharge is yellow or green, and then foul smell, and then it can be accompanied with an itch as well. It shouldn't be itchy there. So sometimes you may find that thrush, for example, is white, and one would say, but the white discharge, but if it's thick and it's itchy, then one would see it sits, and a normal discharge shouldn't do that. So its color is the foul smell, and then there can be an itchiness. So
just talk about, I mean, you took us through some of the age ranges of the people that you normally see, sister. In terms of the male-female split, what's the picture like at your clinic?
In terms of?
Who are you seeing more females than males, or is it more males than females? What is the picture like?
Yeah, we're seeing more men than female.
Right.
Because female mostly are being treated at a gynae site.
Oh, see.
So we see men.
All right.
Female are few.
Okay.
Yes.
Let's talk about, the possible, in females. I mean, you get females that are pregnant, and the whole notion of, passing on some of these infections to the baby. Any common, infections of that nature?
Many of them can be passed on, including HIV, which is important to know. So it's very important that these infections, if they are picked up during pregnancy, should be treated, because the risk definitely is significantly greater that the child can get these infections. And the child is not going to present in the same way that an adult who has these sexually transmitted infections will present. They can present differently because they've obtained these infections in a different manner. So they definitely have to be picked up early, because they can create significant problems for a new child.
Let's talk then prevention strategies, especially for women. I mean, obviously, the whole notion of the Mom Connect during pregnancy and so on. Perhaps you want to comment on that?
Right. So when we talk about prevention, particularly for STIs, is really barrier. One has to treat, if they do get an STI, treatment, complete the course so that we can avoid resistance, for example, or recurring. And one actually needs to ensure that the partner is treated as well, again, to avoid reinfection. When we talk about Mom Connect is a digital platform mainly for pregnant mothers and lactating mothers to interact with the facility with regards to any challenge they may have, whether it's within themselves and the process that they're going through of the pregnancy, or whereas they're breastfeeding, or any challenge that they may get within the clinic itself. So it's interactive between the client and the system. And there are a lot of other digital platforms that we are actually trying to produce or to avail. For example, for young people, we have what is called Be Wise, which is an app. It really talks to young people about all the prevention interventions. And as we said, for women, we do have a female condom now, which is really very empowering for a woman. We don't now kind of rely on the male partner bringing in the condom, or the male partner giving any kind of different excuses for why they are not using
Just by the way, on the female condom, do you have a sense of utilization of female condoms as compared to
relatively, it is still a bit lower as compared to the male condom, for different reasons. One is the fact that we started with the male condom. A lot of people are more comfortable, or they know more about the male condom. Education as well. A lot of people need to kind of know how to use it, because as a female condom, and as we know, the anatomy is different. We don't pull it on, we have to put it inside. So education on correct use, and then we need to look at channels for accessibility, where people can actually, outside of the clinic, for example, access the female condom. And education is very important so that we know how to use it correctly, and then we don't have issues. But yes, it's very good. And the female condom has color as well now, and scent, and a different name. It's called Maxima.
Yeah. So absolutely no reason why it cannot be used.
No reason why it shouldn't be used or cannot be used.
All right. Can we talk about, I mean, we spoke a little earlier, I suppose, what sister being a urology, oncology. Let's talk about the link between STIs and cancer in the females, especially around, HPV. Your comment on that.
So the common one is HPV, which stands for human papillomavirus, which is warts.
Yeah.
There's different subtypes of HPV. And there's a few of those subtypes, a few types of them, which can definitely predispose you to cancer. Yeah. So you would start off in a female, you'd get these small little wart lesions, which would then progress to involve or to turn into a cancer of the cervix. A similar thing will happen on the male. They will get these HPV subtypes, which predispose them to cancer of the penis. And those are things that we need to catch early, we need to treat early. There are vaccinations to prevent them. In females, it's quite widespread, and I'm sure you can tell us about the policy. Yeah. There are male vaccinations as well. They're not available in South Africa as far as I know. But you've got to screen for them. And the common way of screening in a female is to do a pap smear. And that's where you're going to pick up these very early cancers. And you can treat them quite well if you pick them up early enough.
Just quickly before we give her a chance, to tell us about the policy around this. Treatment for STIs in females?
Exactly the same as males.
Right.
Syndromic treatment, you've got to treat them both partners, the male and the female.
Right.
As long as you treat both partners, you should be good.
All right. Perhaps you want to comment quickly on the issue of HPV vaccinations?
Right. So we actually started a big campaign rolling out even awareness and vaccination for HPV. We started with the young people, like in grade 5, 10-year-olds. Yeah. And so it starts there so that we start already trying to prevent the cancers as we're moving forward. Because what was seen is that young people start actually interacting sexually at around 10, 12. So that's why we're starting early before they start, so that at least we can prevent particularly the cancers. Yeah. And as you talk about pap smear moving forward, getting to an age where we are now childbearing, and we continue with the pap smear, and it's free in clinics.
Yeah. The one, talk about childbearing, the one area we haven't touched on is the complications or the impact of repeated STIs in females in terms of how that affects fertility. Perhaps you want to comment on that quickly?
Okay, he did talk a little, or we talk about the treatment, but he can add on, or you can add on as well. The main challenges or complications that we usually talk to when it comes to females, there is a big challenge of infertility, for example. Yeah. Sometimes you may find that untreated STIs may cause ectopic pregnancies in the female, spontaneous abortions, children with low birth weight, stillbirths. So it is all really associated a lot with the baby and mother, especially as we talked about maybe childbearing age or even sexual reproductive health. Yeah. So those become major challenges.
Joanna, Aaron, I would imagine that's the stuff that normally falls into the gynae.
Quite right. Yeah? So most of these are complications from I mentioned earlier about PID, pelvic inflammatory disease. That's when these infections spread upwards, first to involve the womb, and then from there into the fallopian tubes. Yeah. And obviously, as these infections progress, they cause scarring of the tubes, which makes it difficult for implantation of embryos, difficult for the eggs to make their way into the uterus, and that's what results in these fertility issues.
Well, it's that time again. Quick break. When we come back, we'll wrap up our discussion on STIs, and we'll focus a little bit on UTIs because there might be a bit of confusion whether or not UTIs is the same thing as an STI. Well, that after the break. Please stay with us.
This year, Nelson Mandela Day celebrates 10 years of a global movement that has made a difference in the lives of those with the most needs. Over the next 10 years, Mandela Day aims to mobilize governments, policymakers, corporates, civil society, and individuals to make a commitment by focusing on social justice issues and our call to action on the Mandela Day goals.
It is estimated that about 85% of jobs that will exist in 2030 haven't been created yet. On Network, we don't shy away from having these conversations.
Nothing wrong with wanting to be a doctor, nothing wrong with wanting to be a lawyer, but we're talking digital skills. We do coding, we do computer literacy. Beyond what you know, here's what else you can actually look into as a career.
If South Africa invests properly in tech, it can be the next China.
Be a part of our network, Saturdays at 8:30 p.m.
Baletsle Mtetwa joins us now live. MNS attorneys were mandated to conduct these reports and investigations. What sort of processes did they follow?
We heard Tiamo explaining that they worked with actuarial scientists in order to investigate these transactions.
Slap suits, tell us more about this.
The concept of slap suits, which is a litigation often used by big companies to silence critics.
We as civil society won't stand for this kind of intimidation and harassment. If you come to South Africa, you need to obey the obligations that you have in terms of the laws of this country, including environmental laws.
Welcome to Media Monitor. This is where we take a look inside the world of media, analysing the trends and the issues and the reporting of some of the week's top stories. A shocking report states that 51% of South Africans don't trust the news.
The trust levels in independent media have also come from media getting it wrong very often.
Does this mean that our journalists are not credible enough?
We got investigating journalists in South Africa, the best.
Okay, welcome back. We're talking this time UTIs. We've been talking a lot about STIs or sexually transmitted infections. This time we'll talk about UTI, and Dr. Robin Friedman, Senior Consultant from Urology Department at Chris Hani Baragwanath, is going to help us with that. And of course, we still have Dr. Tato Chiradikire from the National Department of Health and Sister Musasele Sakamashabani, also from Chris Hani Baragwanath Hospital. Now, Dr. Friedman, let's talk about now UTIs. I mean, is there a difference between a UTI and an STI?
Definitely. A UTI stands for a urinary tract infection.
Right.
Your urinary tract is the tract from your kidneys,
right,
the ureters, which are the tubes that take the urine from the kidney to the bladder,
right,
the bladder itself, and then the urethra,
right,
the tube that you
right,
void through. So an infection in any of those areas, most commonly the bladder,
right,
and secondly the kidneys.
Right.
Those are what we're referring to as a UTI.
Right.
There can be often an interlink between the two. Often the symptoms might mimic each other sometimes,
yeah,
particularly the burning in the urine, the suprapubic discomfort. And a lot of the UTIs, particularly if they complicate, can result in urinary tract infections, which we would then need to repair.
Okay, so is there a differentiation then between, or are there differences in terms of how they present between males and females and perhaps even children?
UTIs, particularly what we call a cystitis, an infection in the bladder, significantly more common in a female.
Right.
That typically results in burning in the urine, what we call frequency of micturition, so where they're peeing every hour, every half an hour, they can't hold their urine back. Nocturia, where they're waking up regularly to pass urine at night. Blood in the urine sometimes.
Yeah.
Those are typical features for a female. Males shouldn't get urinary tract infections all that often.
Yeah.
The reason is most infections are what we call ascending infections. Yeah. So they're from bugs that are in the perineal area, which can climb up the urethra and into the bladder. Males, because we've got a much longer urethra running in our penis, we don't typically get infections. So a very, very important thing to remember is that if a male gets an infection in his urine, it's what we call a complicated infection. There's a reason why a male gets an infection. And then he needs to typically see a GP or a clinic or a urologist to try and find why. Yeah. It might be a problem with his prostate, might be a problem with urethral strictures as a result of STIs.
Yeah.
But a male with an infection needs to get checked up.
All right. But are the symptoms any different from the female?
Often the same. The burning in the urine, the frequency of urination, the urgency, not being able to hold your urine back, often exactly the same features.
All right. Dr. Charadgir, I mean, I know that the policy in terms of your responsibilities cover, STIs.
Yes.
But do you touch on UTIs and perhaps, education, awareness, that type of thing, just to make that differentiation?
When we talk to STIs, the policy says active symptomatic screening.
Yeah.
And when you look at the symptoms, the doctor has already said they're very similar.
Yeah.
So sometimes one would say, what if it's a urinary tract infection? Then we'd say the idea is to identify the symptom, then you go to the clinician, the nurse, or the doctor, so that they can diagnose and give you a proper diagnosis.
Yeah.
Because it could also be anything more complicated. It could also go up, as he's saying, that it can be a lot more complicated than what one would be thinking.
Yeah.
So the idea is symptomatic screening. If there are symptoms, get diagnosis, get treatment.
Okay. So, sister, just give us a sense of some of the things that you see there. I mean, especially around, we spoke a lot about, obviously infections of the bladder or cystitis.
Yes.
But what about infections of the kidneys themselves? Do you see a lot of those at your clinic?
Yeah, we see a lot of them with the infection of the kidney.
Right.
Remember, I don't know if, Doctor, did you mention the hydronephrosis? Because of normally infection come from like in a female, from the vagina, it goes up until it reaches the kidneys.
Right.
So remember, if they have the infection at the kidney, which is called the pyelonephritis, so they end up having the stents.
Yeah.
So we have too much patient waiting for stents.
All right.
So normally we have too much patient with the problem of UTI affecting the kidneys.
Yeah.
Yes.
I suppose you can comment on that a little further. I mean, she's quite right in terms of how these infections, spread right up to the kidney. But I'd imagine you see quite a lot of complicated urinary tract infections now affecting the kidneys. And perhaps just take us through that and some of the possible causes.
So the vast majority of infections, like we said, are ascending infections. So they start on their way up to the bladder and then up to the kidney, and they kind of involve everything along the way. You can get what we call strictures in the ureters, so scarring within the ureters, which then ends up blocking up kidneys. Severe infections in the kidneys, when they're left untreated, can result in abscesses within the kidney itself, which we often need to drain. Very rarely severe infections, the kidney might need to be removed if these things really are allowed to progress. But most of the time, if we test the patient's urine, we'll detect exactly what bug we're dealing with, and that'll tell us the sensitivity as well to which antibiotic to treat that infection with. And if we treat it in time, again, with the right antibiotic, we can settle these infections down significantly before they become complicated.
All right. In terms of just coming back to that issue of the clinical symptoms, and I can't remember if we mentioned this, the issue of the color of the urine and the issue of blood in the urine. What would that signify?
So, a very important thing is to differentiate between the color and between actual blood. When a patient is well hydrated, and if they've been drinking a lot of fluid, their urine will go clearer, which is perfect. We want every patient to be drinking at least 8 cups of water per day. When they're more dehydrated, their urine will go a darker color. That's very different from what we call hematuria, from what's blood in the urine. When you can physically see red blood in the urine, then we have a problem.
Yeah.
And there's lots of causes for blood in the urine. And infections in the urinary tract are the most common cause for blood in the urine. But we always treat blood in the urine, particularly when you can see it yourself, we treat it always seriously, because the one thing you don't want to miss is a cancer.
Right. And your last words is that we've run out of time in terms of, what people can do to make sure that they prevent these UTIs and STIs.
Okay, especially the female one. Please make sure, remember we sit in the toilet.
Yeah.
Make sure that the seat is clean before we sit. Because of the infection, the E. coli infection can get from the seat of the toilet.
Right.
So make sure, again, if they wipe from the front to the back.
Right.
Not from the back to the front, because of the introduce that. Remember, you talk about the anal E. coli.
Right.
That can be from anal to the vagina.
Right.
So wipe from front to the back, drinking 8 cups of water every day.
Right.
It's a prevention that I can talk about the UTI.
Very wise words to end the show on. Unfortunately, we've come to the end of our show. And Dr. Friedman, Dr. Chiradikire, and Sister Leshoka Bashabani from Chris Hani Baragwanath Hospital. Thank you so much for your contribution. And to you guys at home, thank you so much for watching. We're back on the screens again in a week's time. And until then, please do take care.